Welcome to your educational video on how to place separators or spacers. By now you've had your separators placed, and this video is just to go over what should happen should a separator be lost before your insert appointment for your appliance. You should have received a piece of paper showing which teeth the separators should go between. An X means that the tooth is not present, and the red lines indicate where the separators should be placed. In this case, around this patient's first molar. We'll have given you some extra blue separators in a little envelope, and all you have to do at home, should one become dislodged, is take 2 pieces of floss, gently put them through the separator. Once they're through, make sure that one piece of floss is pulled to one side and the other piece of floss is pulled to the other. The idea behind this is that we want to have 2 handles so that when we do apply pressure to the floss, we can actually make the separator thinner and easier to floss in between the teeth. You'll notice that there are 2 little balls as well. Those indicate the sides of the separators. Once you have your separator ready to go to the patient's mouth where the separator has been lost and apply pressure with your first finger so that the separator then sits half above the chewing surface and half below. It's important to follow those little blue balls on the side, ensuring that both are above the gum tissue. Once it's in place, simply grab one end of the floss and pull to release.